Hello everyone, so welcome back to my YouTube channel. This is Dr. Jasmine Solanki Grewal. So today we'll be discussing about the postnatal and pregnancy exercising guidelines. I've made some very few important points that I think that every pregnant lady should know. So first one is that you don't have to start with a very vigorous exercise, lifting too much of weight and working for hours and hours if you are not a daily working out person. You have to start it very slow. That what you can do is, first of all, you can start it without equipments. For example, push-ups. You can start it with wall push-ups. Then you can after few time when you are comfortable doing wall push-up, you can switch on to bench push-ups. Next one is women who were previously active can continue their exercising or workout, but what they have to do is they have to reduce the weight according to the trimesters. And those who were not very active before their pregnancy can start it very slow without equipment workouts, and then switch on to the very low weight dumbbells and all exercises. Next one is you have to reduce the volume of exercises in your second and third trimester. Next one is you have to avoid prolonged exercise in your supine position because due to gravity it puts pressure on your spine and hip bone and all. Next point that you should always keep in mind is that you don't have to stand for a long time or sit for a long time or lay down for a long time, because when you're standing for a long period, long interval, it puts a pressure on your calf muscles, on your legs, and if you're sitting for a very long time, it puts pressure on your tailbone. So when you're in gym, what you can do is, if you are performing bicep curls while standing, you can sit on a bench and then perform them. Next is that exercises should be avoided when the humidity or temperature is very high, because already when there is fetus, when you are pregnant, the temperature of your inner body is very high. So when the temperature is very high, the outer environment is humid or something, what you can do is you can just avoid exercising that day. Next one is focus on proper fluid intake. Your water contains lots of nutrients that are important for you and for your child, so keep drinking water after a particular period of time. Next one is that utilize your warm-up time with some stretching. During your pregnancy, you have to do some stretching. It helps you in many ways. For example, it kind of prevents from having cramps and all that. Next is that you have to wear supportive shoes. You don't have to wear the shoes which have some heels in them. You can prefer sneakers. They are very comfortable, and or a very good quality shoes like Adidas, Puma, Reebok, whatever brand you like. And also wear supportive undergarments. Your undergarments should be of cotton and supportive, not too tight. No, you don't have to wear very tight push-up bra. It should be according to your size, so that when you are working out, you can easily breathe and it don't put pressure on your fetus, your tummy area. Next is that you have to take a few snacks before you're working out, or what you can do is take few chocolate, banana or dry fruits to your diet, so that you don't feel hungry and all that. Obviously, when you start craving very fast, after a very short interval of time during your pregnancy, so you can just carry some snacks. That's not a problem. Last one is that do not forget to wear panty liners during your second and third trimester, because as the fetus puts a lot of pressure on your bladder. Even when you cough or you laugh or you're doing a weight training or something, you can kind of just pee few drops. So it's better to wear panty liners during your exercises, or even if you are going out, so it's more comfortable. Now talking about the postnatal exercising guidelines. So first one is that obviously important that you have to take the clearance from your physician that you can start working out or not. And if they say yes, what you can do is you have to start with very you can say you have to start it very slow and gradually, and then you have to increase the duration and your intensity. The best way is that you can start with walking several times per week. It is more comfortable and will also give a little bit of power to your legs before starting your workout. Next is avoid dehydration. You have to keep yourself hydrated every time. Keep consuming water after every 1 hour. Half glass of water or half glass of water every 1 hour is okay, and you have to keep yourself hydrated. You have to wear supportive bras during that time, and do not forget to wear milk pads during that time whenever you are going out or whenever you are going to the gym. That is more obvious thing that you have to wear your milk pads during that time. Next one is you have to stop your exercising sessions immediately after in case you observe red heavy blood flow that is more heavier than your regular menstrual cycle. So immediately you have to stop your workout at that time. And yes, you have to drink a lot of water. So these are the most important things that you have to take care of during your pregnancy, when you are going for exercises or when you are working out, and also for at your postnatal time. So I hope this helps. And next topic that we are going to discuss will be about asthma, that what asthma is and what are the exercising guidelines for the asthmatic patient. Thank you.